How's it going, guys? Past level question, micro, mostly for step one, truthfully. Obviously, it could apply to 2CK, but let's just whip through the vignette here. Not going to be a lengthy clip. 39-year-old woman, G2, P2. So G means how many pregnancies she's had. P means how many live births she's had. So she gave birth a week ago. Under 4,000 grams is normal. Okay, so over 4,000 grams is macrosomia. So we're just saying the kid was born at term. 37 weeks to 40 is term. And so it's just a normal delivery. Okay, so she experienced GBS colonization, that's strep agalactiae, and her first pregnancy was treated with peripartum intravenous ampicillin. You can use IV ampicillin or penicillin for 2CK level stuff. Okay, oral augmentin amoxicillin clavulanate is wrong answer. They'll list it alongside. Current pregnancy had no recorded complications. GBS status was unknown. Current pregnancy. Temperature during delivery 37.4. Rupture membranes occurred 15 hours prior to stage 2 delivery of the newborn. If you're studying for step 1, a lot of garbage sounding stuff. I'll elaborate in a second. Newborn slightly irritable and is febrile. Irritability can reflect distress, sepsis, any type of pathology in a neonate, non-specifically. It's something you have to be familiar with in pediatrics. Lab report shows gram-positive rods. Question wants to know the most likely explanation for the neonate's pathology here, as I just said. So what you need to know for 2CK level stuff, I know many of you study for step 1, but for 2CK, if there was mere colonization in a prior pregnancy for GBS, meaning rectovaginal swab 36 weeks was positive for strep agalactiae, but there were no further complications, patient was treated unremarkably, it is not an automatic indication for GBS prophylaxis in the current pregnancy. Okay, that's a very important negative you must know for 2CK. If there was history of what's called early onset GBS disease in the neonate, i.e. sepsis, meningitis, pneumonia in the neonate, yes, that would be an automatic indication for peripartum prophylaxis, ampicillin or penicillin in the current pregnancy. But in this case, we don't have that. And also, if there was history of GBS bacteriuria at any point during the current pregnancy. So if they said in first trimester she had GBS bacteriuria, it was treated successfully, she's not positive now, doesn't matter, you're still going to give GBS prophylaxis in the current pregnancy. And then the relevance of the rupture of membranes or temperature is that if her status is unknown, you give prophylaxis in the current pregnancy only if it's a preterm delivery, as in 36 weeks or earlier, maternal fever 38 or greater, or rupture membranes greater than 18 hours, which we don't have any of that here. So we didn't need to give it in the current pregnancy, ampicillin or penicillin. So all that 2CK stuff, but when you get a question like this, you can glance at the answer choices, glance at the last couple lines, and none of it even matters because lab report shows gram-positive rods, and there's only one listed here. That's a gram-positive rod. You can answer this instantaneously. So let's just whip through the answer choices. E. coli, wrong fucking answer. It's a gram-negative rod. Choice B, Klebsiella, no relationship to pregnancy. Wrong fucking answer. It's gram-negative rod also. Listeria, correct answer. It's the only gram-positive rod listed. So you need to know, and strep agalactiae is gram-positive coccus. So you need to know that in neonates, they like as the top 3 pathogens, GBS, followed by E. coli, followed by Listeria. But they're not going to play trivia like that. They'll simply give you a scenario like this. They'll say neonate has, let's say, sepsis, and lab report shows gram-negative rods. Answer would be E. coli. Lab report shows gram-positive cocci. Answer would be GBS, strep agalactiae. Lab report shows gram-positive rods, as we have here. Answer, Listeria. Not remarkable, not difficult, okay? And you know, they don't have to say buzzy things like she was eating deli meat or soft cheeses while pregnant. That's how Listeria can be acquired, okay? So polymicrobial, although wrong fucking answer in this case, you do need to know, is a very high yield answer choice for OBGYN when they want to know the cause of chorioamnionitis, infection of the uterus while pregnant, postpartum endometritis, okay, infection of the uterus after she's given birth. Answers like for Bartholin gland abscess, polymicrobial. Okay, so those are 3 important polymicrobial answers. Choice E, wrong fucking answer. You know the deal. I'm to make more content. I feel like my subscribe my channel. Appreciate your time. That's it.